Sonudip Bahadur Karki is making a slow and painful recovery from COVID-19. The 74-year-old became ill during a second wave of coronavirus in Nepal that's believed to be a more easily transmitted variant. He is one of several patients at an isolation centre in Sindhupalchok, a district east of Kathmandu. Last week, one of them died.
In the first wave, patients recovered after a week or two, but recovery from the mutant variant in the second wave takes longer and morbidity is higher.
More than 550,000 people in Nepal have got COVID-19. More than 7,000 have died. While recent figures show a dip in daily infections and deaths, experts fear the pandemic has spread to rural pockets, severely testing Nepal's fragile health infrastructure.
More than 90 COVID patients are being treated here in Dhulikhel Hospital on the outskirts of Kathmandu. Many have arrived from outlying districts.
We saw up to 6 deaths a day. The numbers down this week, which is a huge relief.
But with limited testing and contact tracing, there are fears that COVID cases are being underreported.
Before the lockdown, hordes of people left Kathmandu, which was a virus hotspot. The villagers weren't prepared with quarantine or PCR testing facilities. So the virus has spread. We should anticipate a third or fourth wave and plan our COVID response strategies.
Nepal experienced an upsurge in COVID cases in May that overwhelmed its health system. The international community flew in emergency medical supplies in support.
COVID has impacted not only the health sector, it has impacted people's nutrition, it has impacted them in terms of education, it has impacted families in ways that we cannot even describe. And basically, families are finding it difficult to cope. Mental health is a major issue. Families are afraid, and families are finding alternative mechanisms to cope. If we don't do something right away, you will find an increase in child labor, you'll find an increase in trafficking, suicide, and definitely a deepening intergenerational poverty cycle, which we want to ensure that we break.
Last week, the Prime Minister made an appeal for vaccines as the government had faced criticism for its response to the COVID crisis.
We look to the international community for vaccines to help Nepal cope with the pandemic.
Nepal has vaccinated at least 2 million of its 30 million people after receiving doses from India and China. But experts say it needs to inoculate more than 10 times that if it's to successfully weather this wave of COVID-19. Ramyata, Limbu, Jazeera, Kathmandu.